Hi there, it's Dr. Tamara here, and I want to talk today about pelvic pain. A lot of women of all different ages come to see me with pelvic pain, either in an acute sense or in a chronic sense, pelvic pain that's been happening for months and even years on end. Pelvic pain can be really, really debilitating for a woman, and it's really important for us to investigate as much as we can safely to help a woman figure out exactly what's going on so we can institute some management that helps her function on a day-to-day basis. Now, pelvic pain can present in lots of different ways. It can present with a cyclical nature, so pain that happens just around the period or the time leading into the period. It can present in the middle of the cycle, which may in fact just be ovulation pain, what we call Mittelschmerz. Or it can be pain that's intermittent throughout the month, there's no rhyme or reason, or pain that is continuous all of the time. Pain can also be associated with other symptoms. It can be associated with bowel habit change, interruption to bladder function, painful urination, increased urgency or frequency of urination. It can be associated with painful sexual intercourse as well. It can be associated with painful tampon usage. It can even be associated with heavy periods or very irregular bleeding as well. So it's really important that when you think of pelvic pain, you think of the other symptoms that might be associated with it as well. There are so many different things that can cause pelvic pain and lots of things at different stages in a woman's life. For example, pelvic pain in a teenager is likely to be very different to pelvic pain, which is establishing in a woman's 40s or 50s. And we would certainly take age into consideration. We take past surgical experience. Has a woman had surgery for endometriosis before, or perhaps ovarian cysts, or even a cesarean delivery? We also take family history into consideration as well. So if a woman has a family history of endometriosis, for example, there's a 7 times increased incidence of endometriosis in women who have a family history of endometriosis. So all of these things are really important for us to examine, and that's why a comprehensive pain history is super important for us to be assessing your pelvic pain. One of the most important tools that we use in investigations is a pelvic ultrasound. So getting a good quality ultrasound, preferably by a service that does women's pelvic ultrasound, reproductive ultrasound all of the time, to look for the subtle signs of things that could be causing pain, such as endometriosis. So what are the sorts of diagnoses that could be? Well, it could be something as simple as dysmenorrhea, physiological pain that happens when a woman experiences her periods. And we know that this can commonly be the case in adolescence, or even after a woman has had one or two children, they can start to experience increasing painful and also heavy periods. Functional pain. So a woman could be experiencing pelvic floor dysfunction that can manifest itself as reproductive pain that may be associated with periods or the reproductive tract. It could be endometriosis. We certainly know the most predominant feature of endometriosis is pelvic pain, and a detailed history on that is really important. It could be adenomyosis, which is the growth of the lining of the womb within the wall of the womb, whereas endometriosis is in the pelvis. So again, a really comprehensive history and a good quality pelvic ultrasound may be helpful there. It could be an ovarian cyst, particularly a functional cyst. So every month a woman is producing a follicle or a cyst from which she ovulates. For some women, that ovulation process is painful or uncomfortable, or even the collapse of that follicle and some bleeding into it, we call it a hemorrhagic cyst or a cyst accident, can actually cause pain as well. Polycystic ovarian syndrome doesn't really cause pain in itself, but when you get very large cysts that can cause the ovary to twist on itself, or ovarian torsion, that can be very painful and can present in a really acute fashion. And in young girls who maybe haven't yet had a period, if they're starting to experience cyclical pelvic pain, I would always consider obstructions. So a reproductive tract that might have a little bit be a little bit different in the way that it has developed. We call it a Müllerian anomaly. Maybe it's obstructed in some way, and there's a collection of blood that is continuing to grow, and that in itself is causing pelvic pain. But it's important to remember there's lots of other structures down there in the pelvis. There's the bowel, there's the bladder. It could even be musculoskeletal related pain because there's a lot of musculature around the pelvis that could be causing pain. Even lower back pain can manifest as pelvic pain. So go and see your doctor, get a good quality pelvic ultrasound, get referred to a gynecologist who works a lot in pelvic pain. Go and get an examination and work with your gynecologist to figure out what could be causing your pelvic pain.